In Arkansas, more than 18,000 Medicaid recipients lost coverage after CMS approved a work requirement in that state. In New Hampshire, it was nearly 17,000. Both states, the evidence suggests that a large number of these people were either working or eligible for exemptions, but they lost coverage or would have lost coverage because of red tape. Now, you might try to tell us that those people found jobs in employer-sponsored coverage, but a recent study from the New England Journal of Medicine found that Arkansas's work requirement increased uninsured rates without increasing employment. Madam Minister, are you aware of that study?
So first of all, community engagement.
Ma'am, yes or no, are you aware of the study? I have 5 minutes.
I'm sorry, can you repeat the question?
Are you aware of the New England Journal of Medicine study that says that people lost health care because of work requirements in Arizona, or excuse me, in Arkansas?
I'm aware of the article.
Okay. So in November of last year, MACPAC, a nonpartisan agency that makes recommendations on issues affecting Medicaid, said that low-level reporting in Arkansas was, quote, a strong warning that the current process may not be structured in a way that provides individuals with an opportunity to succeed, with high stakes with beneficiaries who fail, end quote. And they called on you to pause disenrollments in order to make adjustments to the program. CMS did not pause disenrollments. Instead, you approved the work requirements in additional states. Why did you approve work requirements in additional states, not respond to the concerns of MACPAC?
Community engagement requirements are about improving the lives of people in the Medicaid program.
Can you point to me to one study that says that a work requirement makes people healthier? One.
So I've worked with the Medicaid program for over 20 years.
I asked Secretary Azar this first question last year.
There are many studies that talk about how employment has a positive impact on health outcomes. There are numerous studies.
No, excuse me. That is, once again, Secretary Azar, I asked this question to him 8 months ago. He gave the exact same answer. You guys run healthcare programs in this country. I am certain you understand the difference between correlation and causation. Healthier people might work. Work doesn't necessarily make people healthier. You are imposing policies on millions of people across this country. Can you show me one study that says that that is a good policy?
I've spoken to many people on the Medicaid program living in poverty, and none of those individuals want to stay where they are. They want to find a pathway out of poverty.
And I'm sure they do. So let's talk about Adrian McGonigal, who lost his Medicaid coverage in Arkansas because of the onerous work requirement that you approved. Without Medicaid, his medication was going to cost him $800. So he did what anyone would do. He left it at the pharmacy, did his best to ignore preventable pain and suffering. He failed. The illness caused him to miss a few days of work, and he got fired. Your work requirements caused him to lose a job and his health care. And again, do you consider that a success? Yes or no?
I think it's premature to draw conclusions about Arkansas.
Premature to draw the conclusion from Mr. McGonigal.
The program was in effect for 10 months. What I will say about
18,000 people lost their health care. How many more people have to lose their health care before you can make a determination?
Community engagement is about giving people a pathway out of poverty. People don't want to live in poverty.
Show me the data that says that no one wants to live in poverty. Show me the data that this actually lifts people out of poverty. One study, one.
There are studies that show that when we're looking at the social determinants of health and we look at improving somebody's health status,
you're not going to spin me. You're not going to spin me for the 5 minutes. I'm going to reclaim my time.
So we need to address holistic issues.
Ma'am, are you aware? You talked about the financial aspects of trying to deliver health care in a fiscally responsible manner. Are you aware of how much Kentucky is planning on spending to implement its work requirements?
I have recused from the Kentucky.
I'll answer it for you. It's $190 million over 2 years. Do you know what per capita annual expenditure on CHIP in Kentucky is?
So states are making investments trying to improve the lives of the people they serve, and those are one-time implementation costs.
Reclaiming my time.
Are you spread over the cost of the life of the program?
A contract that was made for your PR, speech writing, and advanced services was referenced already earlier in this hearing. Are you aware that one of the line items was for a confidant of yours named Marcus Barlow, who was who's scheduled to receive $425,000 over the life of that contract? 1 year.
All of the contracts that we have at CMS are based on promoting the work of CMS. When we use contractors, we use them for 2 reasons. One reason would be when we require specialized expertise that we may not have in-house.
Specialized expertise to write speeches. Are you aware that for that same cost, 2,000 kids could have got, 200 kids in CHIP, eligible for CHIP in Kentucky could have kept their health care? What is a better use of those health care dollars, of U.S. taxpayer dollars, to employ an additional communications person underneath CMS that already has dozens, if not hundreds, or 200 more kids that could get access to health care? What is a better stewardship of those taxpayer dollars?
The use of our contracts are to promote the programs that we have in place.
At the expense of those 200 kids?
Those contracts are consistent with what previous administrations have done.
At the expense of those 200 children?